This lecture covers the second part of Chapter 6, the skeletal system. It includes cartilage, joints and ligaments, and movement classification. Cartilage is a special form of dense connective tissue that can withstand a fair amount of flexion, tension, and pressure. Articular cartilage is at the end of long bones and acts as a cushion within a joint. Another place where cartilage can be found is in the ear and at the tip of the nose. An articulation, also known as a joint, occurs when two or more bones are joined together. The purpose of this joining is for movement. Ligaments are connective tissue which hold together two bones. These are not to be confused with tendons, which use connective tissue to attach muscles to bone. A bursa is a small sac full of fluid which acts as a cushion. It's filled with synovial fluid. In this case, this bursa is padding the patellar tendon. A joint capsule is formed by connective tissue surrounding the joint space. It is also filled with synovial fluid. Arthritis is a general term that denotes inflammation of a joint. Osteoarthritis is joint inflammation caused by normal wear and tear of the bones in the joint. A fibrous joint is a joint which is held together by short strands of connective tissue. An example of a fibrous joint are the sutures in the skull. These joints are typically immobile. Cartilaginous joints are held together by cartilage discs. An example of this type of joint is the disc space between the vertebrae in the spinal canal. These joints are either immobile or only slightly mobile. Synovial joints are classified by a joint cavity lined by a synovial membrane filled with synovial fluid. An example of this is the knee joint. These joints are highly mobile. There are many different types of synovial joints. A saddle joint has one bone shaped like a saddle and another that is shaped like a horse's back. This allows for movement in three different directions, and an example of this type of joint is the joint at the base of your thumb. A ball and socket joint has a spherical shaped bone articulating with a cup-shaped socket. An example of this type of joint are your hips or your shoulders. Ellipsoidal joints have an oval bone which fits into a depression. This allows for 2 degrees of motion, and an example of this are the knuckles of your fingers. Pivot joints have a circular portion of one bone that spins in a ring-shaped portion of another bone. It can only rotate, and an example of this is the joint between the radius and the ulna. Gliding joints exist between the flat plate-like bones found in the wrist or the ankle, and they can only slide back and forth. Hinged joints contain one bone which is shaped like a cylinder and another like a trough. These joints open and close in one direction, and an example is the knee or the elbow. Now we're going to talk about the different types of motion that can occur at a joint. Flexion occurs when a joint is bent in a way which the angle between the involved body parts is decreased. Extension occurs when the angle between the involved body parts is increased. So you see here where the joint is extended, it is at about 180 degrees. Hyperextension occurs when a joint is forced beyond its normal range of extension. Dorsiflexion is the bending of the ankle with the foot moving toward the leg. Plantar flexion is the extension of the ankle with the foot moving away from the leg. Abduction is the movement of a body part away from the midline. I always remember this by thinking that people get abducted by aliens and therefore they are moving away from Earth. Adduction brings the body part back towards the midline, and I think of this as it's adding the body part back to the body. Inversion occurs when the sole of the foot turns toward the midline or toward the other foot. Eversion occurs when the sole of the foot turns away from the midline or away from the other foot. Supination occurs when the wrist is rotated so the palm is facing up. And if you think of it as holding a bowl of soup, then you can think of supination. If you notice when a person's arm is supinated, the radius and the ulna, the bones of the forearm, are not crossed over one another. That is why the anatomical position is with the palm in supination. Pronation occurs when the wrist is rotated so the palm is facing down or towards the posterior portion of the body. Circumduction is the circular motion of a limb. This can usually only take place in the shoulder or the hip joint. Protraction is the movement of the body part anteriorly. Retraction is the movement of the body part posteriorly. Rotation is the spinning of a body part on its axis, just like when you turn your head on the neck.